The blast peeled away the front of the armored personnel carrier like a sardine can. Smoke billowed out, curling through the blood-red sky of Zathur 3 as shrapnel pinged off the remaining vehicles in the convoy. Screams and static tangled in the comms, but through the chaos, one voice cut through. "Medic, I need a medic over here." Private First Class Gordon Zale's voice was hoarse, but the command carried. He was half buried under twisted metal, left leg pinned beneath a collapsed section of plating. Blood soaked through his fatigues at the thigh, dark and thick. Splinters of ceramic armor jutted from his arm, and a deep gash across his forehead leaked down into one eye. 3 alien figures darted across the rubble-strewn clearing, trainees from the Intergalactic Allied Medical Corps. Their uniforms were pristine, clearly new, the fabric still stiff at the seams. Each of them had a different physiology, but their badges bore the same green sigil, student designation. One of them, a tall, blue-skinned Avati with 4 delicate fingers on each hand, reached Gordon first. His name patch read Tarr. "Oh no," Tarr gasped, eyes wide. "He's hemorrhaging. Severe trauma to the femoral region. This is catastrophic." Another trainee, a squat beige creature with a shell-like torso, buzzed nervously as it hovered closer. "He needs cryostasis. Full stasis. We can't stabilize him in the field." "I'm fine," Gordon rasped, teeth gritted. "It's barely a flesh wound." Star blinked. "Your leg is nearly bisected." Gordon coughed and motioned vaguely toward his utility vest. "Tourniquet. Right side. Hurry." Tarr hesitated for a moment too long, prompting Gordon to groan and yank the strap free himself with a trembling hand. He cinched it just above the wound, face draining of color, before slumping back against the wreckage. The shell-bodied alien made a distressed noise. Vitals are dropping, his blood pressure's crashing. The third trainee, a tall, lean Avanari with translucent skin, activated a diagnostic scanner. Red graphs danced across the screen. BP 80/40, pulse 130. He's going into hypovolemic shock. Gordon's lips moved slowly. "Don't have time for textbook panic. Just stop the bleeding." The 3 students crowded around him, fumbling with field medkits. Tarr finally loaded a coagulant injector, his hands trembling as he pressed it to Gordon's thigh. "I don't understand," Tarr muttered. "Your pain response should be overwhelming. You should be unconscious." Gordon gave a weak chuckle. "Maybe I just have a high pain tolerance." "You're losing over a liter of blood per minute," the Avanari said, scaling back the injectors to prevent overload. "This is not survivable without immediate surgical intervention." "Well, good thing I'm not planning to die today." Behind them, a dust-covered sergeant shouted, "Evac choppers en route. ETA 10 minutes. Gordon's breathing was ragged. The tourniquet had slowed the bleeding but not stopped it completely. His leg was mangled, bone likely fractured. The coagulants would buy time, but not much. Tarr looked at his colleagues. "We need to secure the wound further. Apply pressure dressing. Start a fluid line." The shell-bodied trainee fumbled with a saline pack, struggling to locate a viable vein. Gordon's arm twitched when the needle missed on the first attempt. "Try the antecubital," Gordon said, voice barely audible. "Big vein. Easier access." The trainee adjusted, this time succeeding. The fluid began to flow. Gordon's eyes fluttered closed, but he forced them open. "Talk to me," he said. "Keep me awake." Tarr knelt beside him. "What do you want to talk about? Tell me, what you thought medicine was going to be like?" "I thought it would be sterile rooms, clear protocols, no dust, no blood." Gordon let out a dry laugh. "Yeah, well, welcome to the field." The evac chopper thundered overhead, rotor wash scattering debris. Medics in tan uniforms rushed out, replacing the students in a flurry of practiced efficiency. A medic tapped Gordon's cheek. "Zale, stay with me, we've got you." He nodded faintly as they lifted him onto the stretcher, legs stabilized in a temporary splint. As they loaded him into the helicopter, Tarr hovered at the edge of the ramp, face pale. "I'm sorry," Tarr said. "I thought you were dying." Gordon gave a faint grin. "So did I." But hey, barely a flesh wound, right? The doors slammed shut. 2 days later, Gordon blinked awake in a field hospital orbiting Zathur 3. The ceiling panels were white, humming softly. A nurse adjusted his IV line. "Good morning," she said. "You've been through hell." Gordon shifted slightly and winced as pain shot through his leg. He glanced down. His left thigh was heavily bandaged, immobilized in a traction frame. His arm was stitched and splinted, but the swelling had gone down. "Fractured femur," the nurse said, seeing his gaze. "Compound. You'll need surgery, but we stabilized it for now. You also lost a lot of blood. You'll be on iron supplements and fluids for a bit." "How long before I can stand?" "Standing? Weeks. Walking? Months." He groaned. "Figures." The door slid open to reveal a familiar blue face. Tarr entered hesitantly, clutching a tablet. "I asked for permission to visit," Tarr said. "I wanted to see how you were." "Alive," Gordon said. "Thanks to you." Tarr sat, hands folded tightly. "I've reviewed the footage. I made several errors. I failed to initiate pressure dressing in time. I hesitated on the tourniquet. You responded under fire, that counts. I didn't know humans could tolerate that much trauma." Gordon exhaled. "We don't. Not really. I was in shock. That's why I didn't pass out." Tarr stared at him. "But you remained lucid. Gave instructions. That's not normal. It's not ideal. But when it's life or death, sometimes you do what you have to." There was a pause. "I've been studying human anatomy," Tarr said. "Our models underestimated your vascular resilience. Your arteries constricted under pressure more than predicted. That likely slowed the bleeding. Guess evolution did us a favor. I still don't understand how you joked. You were actively dying." Gordon stared at the ceiling. "Sometimes it's all you have." Tarr nodded slowly. "I want to learn more. Not from books, from you. I know I'm not a teacher. You're alive. That's qualification enough." The next few weeks passed in a haze of physical therapy, painkillers, and slow progress. Gordon underwent surgical fixation of the femur with an intramedullary rod. The orthopedic team explained the process: clean the wound, align the bone, insert the rod through the marrow canal, and secure with screws. He was under anesthesia the whole time. Post-op, the pain was brutal. He couldn't move without assistance. The rehab started with isometric contractions, then progressed to assisted range of motion exercises. By week 4, he could sit upright and use a walker for short distances. Tarr visited regularly, sometimes with questions, other times just observing. He took notes on Gordon's reactions to medications, his wound healing, and his emotional state. Gordon endured it all with a mix of grit and sarcasm. "You want to know the worst part?" he said one afternoon, struggling to adjust the pillow under his leg. Beneath the thick layers of terror. "PT, physical therapy. It's not the combat that gets you, it's the rubber bands and balance boards." Tarr nodded solemnly. "I believe you." By week 6, Gordon could walk short distances with a cane. The arm had healed faster, the fracture minor. The lacerations on his head had left a scar, but nothing that worried him. One morning, as he limped through the hospital garden, Tarr joined him. "I was assigned the trauma rotation," the alien said. "Because of you, lucky you. I want to be prepared next time. No hesitation." Gordon stopped and leaned on the cane. "You're already better than most. You froze, yeah, but you learned. That's what matters." Tarr looked at him seriously. "If I ever see someone with injuries like yours again, I won't panic." Gordon gave a crooked smile. "Good. Just don't expect them to say it's barely a flesh wound." Tarr tilted his head. "That still confuses me." It was clearly not. "It's a joke from an old Earth movie." "Why would you joke in that moment?" "Because if I didn't, I'd scream." For a moment, neither spoke. Then Tarr nodded. "I think I understand. Pain doesn't always mean panic. Exactly. They walked in silence, the sun rising over the orbital station's artificial horizon. Gordon's limp was pronounced, but steady. He would recover. Slowly, realistically, with effort. And Tarr would remember. The rehabilitation wing aboard the orbiting field hospital was always too quiet at night. No gunfire, no shouting, just the occasional hum from the power conduits in the walls and the soft clicking of mobility aids against the reinforced flooring. Gordon hated it. The silence let his body remind him how much it hurt. He sat on the edge of his low-grav therapy bed, sweat clinging to his undershirt, right hand clenched around the handle of a resistance sphere. The therapist had insisted on hand-strength exercises today, even though the leg was still the major issue. Something about overall functional independence. He squeezed again and felt the ache shoot up into his shoulder. Outside the therapy room's transparent wall, the stars drifted lazily past. Somewhere way below, Zathur 3's red atmosphere glowed faintly. He hadn't thought about the planet much since the explosion. Only the med bay and the excruciating minutes after. The door opened with a hiss. Tarr entered, carrying what looked like a portable diagnostic cart. Instead of his usual training scrubs, he wore a sleeveless vest and utility belt. A new badge glowed on his chest. Emergency Response Observer. "I thought you were rotating in trauma now," Gordon said, placing the resistance sphere down. "I am, but I requested auxiliary hours in recovery. I've been following your file." "Creepy." "It's a professional interest. Also, they said I could learn a lot from watching how humans rebuild function. I'm honored to be your living case study." Tarr looked at the readout on Gordon's chart. "Your quadriceps activation has improved, but your knee flexion's lagging." "Yeah, no kidding. Try bending a leg that feels like it's full of knives and dry concrete." "I could adjust the stim settings or assist with proprioception calibration. Unless that's code for make it stop hurting, I'll pass." Tarr rolled the cart beside him and tapped the screen. "Pain is a neural signal. It's not inherently—" "Don't," Gordon said, giving him a look. "Don't try to science me out of it. I'm not a data point." Tarr paused. "Understood." They sat in silence for a moment. Tarr adjusted the cart's parameters. Gordon watched the alien's fingers dance across the interface. Methodical but oddly hesitant. "You ever seen a post-op human before?" Gordon asked. "No, you're my first." "Lucky you." Tarr tilted his head. "Why do humans use sarcasm when discussing misfortune?" "Habit. Makes things sting less. I've tried to emulate it, but it confuses people, especially the Andari. They take everything literally. That makes two of us." Tarr hesitated again, then tapped the cart. A series of holographic images projected outward scans of Gordon's femur from 2 weeks ago, followed by more recent ones. "You've formed early callus tissue around the fracture site. That's unusually fast. I drink a lot of milk." Tarr squinted. "Is that sarcasm?" "Yeah." "I see." The images shifted to show the titanium rod and screws securing the femur. Gordon glanced at it, then away again. "Looks like scaffolding." "Is, essentially, internal support while the bone rebuilds. Your marrow cavity's already repopulating." "Yeah, but the nerves don't care how pretty the scan is. It still burns when I try to lift it." "That's normal. The surrounding muscle underwent significant trauma. The pain comes from regeneration, not just damage." "Great. So healing hurts worse than the injury." "No. Not worse, just longer." Gordon slumped back slightly, rubbing his eyes. "I miss walking without thinking about it. You ever think about how much we take for granted? Like, I used to run just because I was late to breakfast. I cannot run. My species evolved on a low-gravity moon. Our locomotion is based on gliding propulsion. Must be nice. You ever break anything?" "Once. I ruptured my lower strut membrane during a glide failure. It healed in 2 days." Gordon shook his head. 2 days? I've been in here over a month. Your biology is complex. Slower to heal, but more adaptable under duress. Feels like a consolation prize. Tarr adjusted the stim settings. A soft vibration began along the side of Gordon's thigh. There. That should reduce the muscle spasms. Temporarily. Thanks. A moment passed. Gordon shifted, testing the leg. The burn was still there, but the cramping had eased. You know, he said, most med students wouldn't stick around a patient this long, especially one who bites when poked. I've been assigned to observe human resilience responses. That's not a clinical term. It is now. I submitted it last week. They're considering adding it to the Interspecies Traumatic Recovery Index. Gordon blinked. You made up a whole metric? Yes. It tracks recovery versus expected statistical baseline across species. Humans consistently outperform predictions, despite inferior regenerative rates. That's because we're stubborn, not superhuman. So that's part of the hypothesis. There was a sudden buzz at the wall terminal. A nurse's voice filtered through the speaker. Zale, your hydrotherapy session was bumped to early cycle. Transport in 15 minutes. Gordon groaned. More underwater squats, my favorite. Tarr stood. I'll accompany you. I want to monitor your cardiovascular adjustment during aquatic resistance. You just want to see me try not to drown. Never seated too. The hydrotherapy chamber was located 2 decks down. They descended via a slow platform elevator, which gave Tarr enough time to scan Gordon's vitals again. He didn't comment on the elevated heart rate. Inside the chamber, the water was held in a zero-pressure dome, held together by containment fields. Gordon stepped in slowly using the pool rail, every movement exaggerated by the resistance. Once submerged, he floated gently, suspended by a buoyancy harness. A therapist, human this time, handed him a foam barbell and motioned for leg extensions. You're up to 8 reps per set now, she said. I remember, Gordon muttered, bracing himself. First rep, burn. Second, more burn. By the 4th, he was gritting his teeth. Tarr observed from the dry side of the dome, tapping readings into his pad. You're tensing your shoulders, he called. I'm trying not to scream. Try to exhale during effort. It redirects neural load. Gordon laughed once, then winced. But he tried it. On the next rep, he exhaled slowly, and the movement went smoother. After the set, he floated back toward the side. You're useful. Annoying, but useful. I'll take that as positive reinforcement. Later, as he dried off and changed back into standard-issue fatigue pants, Gordon caught Tarr watching his reflection in the mirror. What? Your scar, Terry said. It's healing unevenly. I don't care how it looks. No, I mean the tissue density is irregular. It could affect skin elasticity near the knee. You're saying I'll have a stiff, ugly knee? I'm saying it may need localized massage therapy to maintain pliability. Okay, but I'm not letting you rub my knee. I wasn't offering. They both laughed then, and for the first time in weeks, Gordon didn't feel like he was dragging a lead weight behind him. Back in his room, he sat gingerly on the bed. Tarr lingered by the door. Tomorrow, Tarr said, they're assigning me to a field rotation. I won't be on station. For how long? 3 cycles. I'll be embedded with a mobile evac unit. Gordon nodded. Good. You need real exposure. I'll send updates on your file. Don't bother. I'll still be here swearing through lunges. Tarr hesitated, then said, Will you be all right without the observation? I'll manage. I've got a stubborn leg, not a missing brain. Still, Tarr said, your resilience response is anomalously high. I want to know how it ends. Gordon leaned back, wincing slightly. Probably with me jogging again, complaining about how slow I am. I look forward to it. The door hissed closed behind him. Gordon lay back, staring at the ceiling, the ache in his leg pulsing in rhythm with the low thrum of the ship. No explosions, no chaos. Just the long, slow crawl back to normal. And somewhere out there, a blue-skinned trainee was carrying a new metric into the field. The moment Tarr stepped back onto the orbital ward, 6 weeks had passed. His new assignment badge had dulled at the edges from field wear, and his gait had changed, less cautious, more deliberate. He carried a small case under one arm, marked with the seal of the Allied Emergency Response Division. The station's artificial gravity welcomed him with a familiar tug, but the corridors felt narrower than he remembered. The medbay's lighting was brighter than any evac tent he'd worked in. Cleaner, too. It all felt oddly sterile now. He found Gordon in the upper rehab module, seated at a resistance sled. The human was alone, one hand gripping the side rail, the other adjusting the tension dial. His left leg still wrapped in a compression sleeve, braced against the footplate. A thin line of sweat crept down his temple as he exhaled, pushed and let the sled slide forward an inch. "You're late," Gordon said without turning. "You weren't expecting me. I figured you'd show up eventually. You're stubborn like that." Tarr stepped inside. "You've progressed. The joint angle's improved. 85 degrees last check. Still feels like someone jammed a rusted hinge in there. I brought something. You always do." Tarr opened the case and set a small device on the bench beside the sled. It looked like a flattened disc with a flexible band attached. "Pulse torque stabilizer," Tarr said. "It syncs with your contraction timing, can reduce strain on the patellar tendon while loading." "Did you invent that just to make my legs stop whining?" "No. But I adapted the parameters for human musculoskeletal delay threshold." Gordon looked at it suspiciously. "It's not going to electrocute me, is it?" "Only if you attach it backwards." Gordon took the band, looped it around his leg just above the knee, and locked the disc into place. It hummed softly as it synced to his biopulse. He nodded once and resumed the movement press. Hold, release. The sled moved smoother now, less wobble on the extension. "All right," Gordon said. "I'll give you credit. That's the first thing that's made this bearable all week." Tarr sat opposite him on the diagnostics bench. "Field conditions changed my understanding," Tarr said. "We had 3 thoracic ruptures, 2 limb crushes, and a decompression injury within the first 5 shifts. None of them human. None of them made it." Gordon didn't respond immediately. The quiet between reps stretched longer. "Didn't expect to hear that?" "I didn't expect to feel it." "You'll get used to it. You have to." "I'm not sure I want to." Gordon adjusted the sled angle to increase resistance slightly. His jaw tightened as he pushed again. "Pain still there?" "Yeah, but it's different now. Not sharp anymore, just stubborn." "That's a good sign. Stubborn pain implies tissue remodeling." "You say that like it's comforting." Tarr leaned forward. "I reviewed your telemetry from the last week. Your heart rate variability's improved, sleep cycles stabilized. You're metabolizing the medication faster." "They cut my dosage," Gordon said. "Didn't tell me until I tried to stand and almost swore loud enough to trigger a security alert." "You didn't request reinstatement?" "No point. If I'm gonna walk again, it's gonna hurt. Might as well get used to it." Tarr blinked slowly. "You're voluntarily enduring it, without pharmacological buffer. We're in Port Jansen together, Danielson. I'm staking the 2nd floor there." Gordon frowned. "You sound surprised." "I am." Gordon let go of the sled handle. "That's the part you still don't get, isn't it? I understand the physiological mechanisms. I'm not talking about mechanisms. I'm talking about what it means to keep going when everything hurts. You think resilience is about enduring damage. It's not. It's about choosing to keep moving, even when you know the damage won't stop." Tarr looked down at the floor. "I never saw it that way." "That's because you haven't had to live it yet." "I suppose not." Gordon stood slowly, weight shifting onto his cane. He walked a few steps toward the hydration station, careful but unassisted. "You brought anything else in that magic case?" he asked over his shoulder. Tarr opened the lower compartment and pulled out a small canister. "On-synthetic protein gel. Your charts say you've been deficient in leucine uptake. This one's formulated for human absorption rates." Gordon took it, sniffed the nozzle, and recoiled. "Smells like scorched algae. Filtered through a bioreactor. Delicious." He downed it anyway and grimaced. Tarr handed him a second one without comment. They sat together on the bench by the window, looking out at the distant stars. Gordon rubbed his knee absently. You ever wonder why humans don't just opt for cybernetic replacements? Tarr asked. Because we're still a little vain, and because once you lose something biological, you never get it back. But the replacements are more efficient. Sure, but not ours. Not yet. You ever try to run diagnostics on a limb that's also supposed to feel like it's part of you? No, it's not the same. Synthetics clean. Too clean. Real pain reminds you that you're alive. Tarr paused. In the field, I encountered a species that severs damaged limbs preemptively. Prevents infection, they say. Sounds efficient. It was horrifying. That's the difference, Gordon said. You're starting to feel it. The cost. Tarr tapped his pad once and looked up. Your discharge date's been set. 3 days. You've met all the mobility thresholds. Didn't think they'd let me go that soon. You're not fully healed, but you're functional. Story of my life. Tarr hesitated. Will you return to service? Not combat. Not yet. Maybe never. But I'll find something. Logistics, maybe. Training. I'm not crawling back into a bunk just to rot. I didn't think you would. Gordon looked at him. What about you? You going back to the field? They offered me a placement with the trauma response fleet. I declined. I requested reassignment to human medicine. Gordon blinked. You want to specialize in us? There's too much I don't understand, and too much I want to. Gordon chuckled quietly. You're going to be very tired. I'm already tired. They sat in silence for a while longer. Eventually, Gordon stood, stretched his leg carefully, and walked a full circuit of the module without his cane. It wasn't fast, it wasn't smooth, but it was upright. Guess I'll have to start running again, he said. Eventually. Not today. No. Tarr stood too, watching him. You were right, you know. About what? It wasn't barely a flesh wound. Gordon gave a lopsided grin. I know, but it made you move faster. Tarr nodded once, slowly. As Gordon gathered his things, the cane, the resistance band, the gel canister, he paused at the door. Hey, Tarr. Yes. Thanks. For sticking around. I learned more from watching you heal than I ever did in a classroom. Gordon nodded. Glad I could be your walking medical mystery. You're not a mystery. No. You're a lesson, one I plan to pass on. Just don't make them drink the algae gel. No promises. They left the module together. The corridor lights dimmed slightly for rest cycle, casting long shadows against the walls. Gordon's limp was still there, but it was less pronounced. Each step was deliberate, but steady. He didn't look back. And he didn't need to.